stand at 15,712 in India, 507 deaths and 2,230 recoveries so far. Government amends FDI policy to curb opportunistic takeovers of Indian companies in light of the current COVID-19 pandemic. New norms state that an entity of a country sharing land border with India can invest only under the government route. Health Ministry issues advisory against spraying of disinfectant on people for COVID-19 management. Says spraying of individuals or groups is not recommended under any circumstances. Government clarifies that so far no decision has been taken to open domestic or international flight operations. Advises airlines to open their bookings only after a decision in this regard. In international updates, India continues to give helping hand to various countries across the globe in the fight against COVID-19. Kazakhstan and UAE thank India for providing medical supplies for treatment of the patients with COVID-19. COVID-19 cases continue to spiral up globally with more than 23 lakh cases. More than 1.6 lakh people have succumbed to the disease. US records 1,891 coronavirus deaths in the past 24 hours. Total number of deaths in the US nears 39,000. Italy registers 482 more deaths in the past 24 hours. France reports 642 more coronavirus deaths in the last 24 hours. Spain planning to extend lockdown till May 9. China reports 27 new confirmed novel coronavirus cases, of which 17 are imported, while no new deaths were reported. Those were the updates and the headlines. First, we'll take the stock of the developments in India in our segment Ground Zero. COVID-19 cases in India, according to the Ministry of Health and Family Welfare, the latest data put forth by the ministry is total confirmed cases in the country now stand at 15,712. Whereas active COVID-19 cases in India stand at 12,974. 507 people have succumbed to the illness so far, while 2,230 people have recovered. And up next, we'll get you the state-wise breakup of the COVID-19 situation in the country. And on our video wall, very quickly, we'll get you the map, which will tell us in detail the current situation of the pandemic in the country. Here we see the state-wise breakup. When we talk of Maharashtra, 3,651 confirmed cases, and active cases of these are 3,075. 365 recoveries have been made, and 211 have been the people who have succumbed to this illness. So that is the toll when we talk of Maharashtra. The next state we see is Delhi. Total confirmed cases are 1,893. Active cases are 1,779. 42 deaths have been reported from the national capital. Added to that, 72 people have made recoveries. They have recovered from the disease. And when we talk of the next state we pick is the Madhya Pradesh, the state of Madhya Pradesh. Confirmed cases have been 1,407. And out of these, 1,210 have been the active cases. 70 people have lost their lives, and 127 people have completely recovered from this disease. Gujarat, when we talk of this state, in Gujarat, 1,376 confirmed cases. 1,230 of these cases are active cases. 93 people have recovered completely, and 53 deaths have been reported from Gujarat. And after this, next state down south we pick up is Tamil Nadu. Tamil Nadu, the total number of cases is 1,372 and 992 of these cases are active cases. 15 people have lost their lives and 365 recoveries have been made. This data has been put forth by the Ministry of Health and Family Welfare. Rajasthan, when we talk of the situation in Rajasthan, 1,351 confirmed cases have been reported. 1,157 have been the active cases. 11 deaths have been reported from the state. Added to that, 183 recoveries have been reported from the state. The next state is the state of Uttar Pradesh. 969 confirmed cases have come to light, and of these 869 are active cases. 14 deaths have been reported from the state and 86 people have recovered in Uttar Pradesh. After this, the next state is Telangana. 809 confirmed cases have been reported from Telangana. 605 of these cases are active cases. 18 deaths and 118 recoveries have been reported from the state of Telangana. After this, Andhra Pradesh is the next state. Confirmed cases is 603, and out of these 546 are the active cases. 42 recoveries have been made and 15 people have lost their lives owing to the pandemic. When we talk of Kerala, in Kerala, 400 confirmed cases have come to light. Out of these, 140 are active cases and 257 people have recovered from the illness and 3 people have lost their lives. And when we talk of the current situation in Karnataka, 384 confirmed cases have been reported from Karnataka. 266 have been the active cases. 14 people have lost their lives and 104 recoveries have been made from the state of Karnataka. And up next, in north of the country, Jammu and Kashmir, 341 cases have been reported from the Union Territory. Active cases are 285. 51 recoveries have been made and 5 people have lost their lives in Jammu and Kashmir. When we talk of the current situation in West Bengal, 310 cases have come to the light. Active cases are 236. 12 people have lost their lives and 62 recoveries have been seen in the state of West Bengal. Now going across to Haryana, 225 cases have come to the light. Out of these, 179 are active cases and 43 people have recovered and 3 people have lost their lives in Haryana. Even as we get you the details and we get you this statistical data of the states in the country, we do not have to forget that on the global page, India's fight against the pandemic has been appreciated. And when we talk of the figures coming in from Punjab, the confirmed cases have been 202 and active cases have been 162, and 27 people have recovered from the illness and 13 people have lost their lives so far from this pandemic in Punjab. When we talk of the situation in Bihar, 86 confirmed cases. Out of these, 47 are the active cases. 37 recoveries have been made and 2 people have lost their lives in Bihar. And next is Odisha. In Odisha, active cases are 36, 24 are recovered cases and 1 life has been lost, and total confirmed cases are 61 in Odisha. In Uttarakhand, the confirmed cases are 42. Out of these, 33 are active cases. While no death or no casualty has been reported from the state, 9 people have completely recovered from the illness. And again, going across to northern part of the country, Himachal Pradesh, 39 confirmed cases have been reported from the state. Out of these, 22 are active cases. 16 people have recovered from the disease and 1 person has lost his life owing to this pandemic. And in Chhattisgarh, 36 cases have come to light. Out of these, 12 cases are active cases and 24 people have recovered from the disease and no casualty, thankfully, has been reported from Chhattisgarh. When we talk of Assam, 1 casualty has been reported from Assam. 35 are the confirmed cases, out of which 22 are active cases and 12 persons have recovered completely in the state of Assam. The next state is Jharkhand. In Jharkhand, 34 cases, confirmed cases have come to light. Added to this, out of these, 32 cases are active cases. 2 people have so far succumbed to the illness. So more or less, when we talk of the situation in Chandigarh, 23 confirmed cases of the disease have been put forth, and active cases of these are 13, and 10 recoveries have been made. Time and again, we have been highlighting of how you have to take care of yourself. Precautions and self-care is the only way by which you can keep yourself safe and also people around you safe. When we talk of the situation in Ladakh, 18 confirmed cases. Out of these, 14 are active. 14 people have recovered. Also, when we're getting you the confirmed and the active cases, we're equally showing you and equally emphasizing on the recoveries that have been made. And you also have to take note of that. And also, you have to keep yourself safe, stay at home, stay isolated. And when you're out in public places, maintain social distancing, maintain personal hygiene. These are the guidelines, these are the precautions which have repeatedly been put forth, not only by the government, but also we as public broadcasters have been reminding you time and again. When we talk of Andaman and Nicobar Islands, the confirmed cases are 14. Out of these, 3 are the active cases. And again, 11 people have recovered from the illness. With that, we go across to Meghalaya. Meghalaya, 11 cases have been confirmed. Out of these, active cases are 10, and 1 person has lost his life owing to the pandemic. And when we talk of Puducherry down south, 7 confirmed cases. Out of these, 4 are active cases and 3 recoveries have been made. Thankfully, no casualty has been reported from Puducherry. And going across to Goa, out of the 7 confirmed cases, 1 case is active and 6 recoveries have been made in Goa. When we talk of the current situation of COVID-19 in Goa, in Manipur, out of the 2 confirmed cases, 1 is active and 1 recovery has been made in Manipur. So this was a pan-India detailing of the current situation owing to COVID-19. When we go across to Tripura, out of the 2 confirmed cases, 1 is active and 1 recovery has been made in Tripura. And when we talk of Arunachal Pradesh, in Arunachal Pradesh, 1 confirmed case is there and that case is active, and this has been put forth from the state of Arunachal Pradesh. So that was a pan-India in detail map showing us of how the situation is unfolding. And here we have the details of Mizoram also coming in, 1 confirmed case, and that case is still active. So again, the crux is you have to take note that you have to take precautions and you have to ensure that you keep yourself safe and also people around you safe. So here, the overall situation of the country, the confirmed cases are 15,712. Out of these, 12,974 are active cases. 2,231 have recovered so far from the illness, and 507 have been the casualties. This is the data which has been put forth by Ministry of Health and Family Welfare. And this is the current situation of the pandemic in the country. And when we talk of the daily briefing, which was held by the Ministry of Health, the spokesperson of the ministry said that the field level actions by union and state governments are yielding positive results. Mahe in Puducherry and Kodagu in Karnataka have not registered any new case in the last 28 days. A total of 45 districts in 23 states have not registered any new case in the last 14 days. Of the total 45 districts, 22 new districts from 12 states are recent additions. Dholpur and Udaipur in Rajasthan, Vishakhapatnam in Andhra Pradesh, Karimganj, Golaghat, Kamrup Rural, Nalbari and South Salmara in Assam are among these new districts. And Aisha Khanum is joining us from Bengaluru to get us more on that. Aisha, first of all, let us know the details of how the situation is there in the state. Also, we tell our viewers that that there is this particular district in Karnataka which has not reported the cases for the any new COVID-19 case in the past 28 days. So let's talk more about the strategy which has been put forth in the state, and that the lessons which the rest of the country needs to learn from this district. Aisha?
Well, Preeti, in Karnataka, the state government has taken precautions and the lockdown is strictly implemented. And also the fact that Karnataka is leading the country in using the digital technology and IT technology to the best use to combat the coronavirus disease. And the fact that there are no new cases that have been reported from Coorg is that Coorg is a very hilly region. It is otherwise known as the Scotland of India. And this place has not reported any new cases because precautions have been taken with regard to social distancing, and the fact that people in Coorg, there is a high level of literacy also in Coorg. So the social distancing and the complete lockdown has worked very well in Coorg as such. So that is why no new cases have been reported. Also, the fact that Karnataka till now did not have a single case of COVID-19 disease in over 12 districts. And that was the fact that the state was considering lifting the lockdown in these 12 districts. But now the Karnataka government reversed the order and said the lockdown will continue till May 3rd. And if we were to
Right.
talk about Bangalore, which is the Bangalore urban district, which is the hotspot in the state, is using the digital technology to the maximum. And also the hospitals are well equipped here. The government is ramping up the infrastructure across the state. The hospitals are being turned as designated COVID hospitals. And in Bangalore also, we see that many hospitals are ready with beds, ventilator facilities, oxygen facilities, if the cases rise. So the government is working round the clock 24/7 with the corona war room.
Yes,
And
indeed. The
also the fact that
precautions, the
today,
guidelines which have been put forth by the center, they can only bear fruit only if the people and the state governments ensure that the guidelines and these precautions are effectively implemented. So thank you so much, Aisha, for joining us with those inputs from Karnataka. And yes, again, we are highlighting the important point of ensuring yourself, the safety of yourself and the people around you by staying isolated and maintaining social distancing. Also, the combined efforts of the centre government and the government of Maharashtra is ensuring adequate food security for all the poor people in the state. 43.51 lakh quintals of food grains have been distributed within the first fortnight of April amidst the lockdown period. Now, under the Pradhan Mantri Garib Kalyan Ann Yojana, 5 kilograms of food grain is being provided free of cost for 3 months for every beneficiary covered under the National Food Security Act. In addition, 1 kg of pulses, either tur dal or chana dal per family is also being provided free of cost. The Maharashtra government has expanded the ambit of its PDS system and has decided to provide grains to orange ration card holders who fall in the above poverty line income bracket of 10,000 to 1 lakh rupees per annum as the income. The state government has also decided to pay 2,000 rupees each to over 12 lakh registered construction workers in the state who have lost their livelihoods due to the ongoing lockdown. The current count of COVID-19 patients in the state of Maharashtra is 3,651. 328 new patients have been identified as positive for the pandemic. Of these, 365 COVID-19 patients have been cured and discharged from the respective hospitals. And we're going across to our correspondent Shama Mishra. Shama, we've given a broad outline of how help is being given to the people below the poverty line in the state of Maharashtra, and also the efforts which have been put forth by the state government along with the efforts of the centre. Let us know more about the current situation in the state.
Yes, Preeti, like you've already mentioned that around 43 quintals of the food grains have already been given through the PDS system. We are also seeing that, around 1 lakh sugarcane workers that were stuck in the farms, they were asked, they were given the permission to return to their homes, return to their villages after necessary checkups were done and the tests were done. So these people have returned to their homes. Also, you've mentioned that 2,000 rupees one-time financial help to the construction workers who are registered. They would be getting a financial help of 2,000 rupees. Remember, there are 12 lakh workers, construction workers in the state who would be receiving this amount. And yes, we are seeing across the state many such measures have been taken both from the central government and the state government, because it is in time when people who are stranded, they need to have some ground for their livelihoods. Also, we are seeing different measures apart from the state government, the BMC, the local administration, they are carrying out. The places that are declared as containment zones or hotspots, these areas have been, under supervision through various efforts or through various equipment, including the drones. We are seeing that, the health minister and the home minister of the state, they are appealing again and again to these people. And also we saw a huge drone carrying a loudspeaker that was implemented, that was sent in the areas of Worli, which has been the most bad affected area in the pandemic. Also, this area is G ward, and we also saw that BMC regularly on their website are releasing the maps ward-wise, where you can see which is the worst affected areas in Mumbai, and totally avoid going in such places. Priti.
All right, Shama, thank you so much for joining us with those inputs from Mumbai. And Information and Broadcasting Minister Prakash Javadekar on Jaan Bhi Jahan Bhi said that from 20th of April, few pockets of the economy will open. He further said that it is very important move from 20th of April, as gradually the economic activity will pick up.
कल से एक पड़ाव है कि जब आर्थिक गतिविधियां खासकर ग्रामीण इलाकों में शुरू होगी, जो खेती के लिए जरूरत है वो खेत से लेकर खलियान से लेकर बाजार तक सब कुछ खुलेगा और प्रोसेसिंग तक। उसके बाद खुलेगा कल से उद्योग जो है ग्रामीण इलाकों में वो सब खुलेंगे, तो वहाँ रोजगार और बाकी सब होगा। कंस्ट्रक्शन, जहाँ कंस्ट्रक्शन हो रही है वहाँ सोशल डिस्टेंसिंग का नॉर्म पालन करके वो भी शुरू होगा। इसके सिवा जिनके इंडस्ट्रियल इस्टेट्स है और इंडस्ट्रियल शेड्स है, ऐसे जगह भी काम शुरू होगा। तो मुझे लगता है कल से एक बड़ा काम अच्छा शुरू होगा और उसका परिणाम होगा।
He also added that we will ensure that impact of coronavirus also reduces in urban areas so that economic activities there also catch up soon.
कल से देश में एक विश्वास निर्माण होगा शहरों में भी कि हम भी जल्दी मात देंगे कोरोना को, तो हमारे यहाँ भी जल्दी इकोनॉमिक एक्टिविटी शुरू होगी। तो ये आर्थिक गतिविधियां शुरू होने का बड़ा लाभ है और देश का गाड़ी चल पड़ी है, ऐसा हम कह सकते हैं।
Information and Broadcasting Minister also said that the country's focus will be on safety and security of the poor and the farmers.
किसान के खरीद की व्यवस्था की है, किसान को जो सहायता देनी है वो दे रहे हैं, किसान सम्मान निधि 6,000 रुपये दे रहे हैं और उसके साथ साथ किसान और गरीब परिवारों के लिए अनेक सहूलतें दी है। तो किसान को उसकी फसल बाजार में जाना, यही तो सबसे जरूरत है, वो अभी हो रहा है और उसके कर्जा और बाकी सारा मिलते रहना, ये भी जरूरत है, ये पूरी हो रही है।
So that was the assurance coming in from the Information and Broadcasting Minister. On that note, we'll end this special edition here. That's it. We've got time for today. But again, keep yourself safe and also ensure the safety of your near and dear ones. Maintain personal hygiene. Keep washing your hands regularly and also properly, and ensure that you follow the norms of staying at home and also the norms of social distancing. Keep yourself isolated. On that note, we'll take your leave. Bye-bye.